In most cases, whiplash occurs as the result of rear-end collisions. In this video, we see what happens in a collision with a delta V of less than 10 km per hour. At changes in speed of about 8 km per hour, head and neck are subjected to an acceleration of 4g, which exceeds the range of tolerance of the ligaments. Within less than 125 milliseconds, a maximum extension is reached, which is well below the muscle reaction time of 200 milliseconds. The distance traveled is only 10 centimeters. These two circumstances cause a braking acceleration which can be 2.5 to 5 times higher than the acceleration of the car. Two abnormal and violent movements are thus produced, which overextend the head and neck area in an unnatural manner. These movements cause a number of injuries, most of which can only be objectively discerned with difficulty in medical imaging. Overextension or tearing of ligaments. Contusions at the surface of bones and cartilage cracks with hemorrhaging in these structures. And herniated discs. Stretching may occur, both of the arteries and of the nerves. Inside the head, injuries to the brain tissue and also to the inner ear may occur. During the backward motion, the vertebrae are pulled apart at the front. This causes hyperextension and even partial tears of the anterior ligaments. And during the forward motion, the vertebrae will fan out at the back of the neck, which causes the intervertebral ligaments to extend or even tear. The movements within the neck are possible due to the facet joints. The vertebrae move inside their cartilaginous sockets and are stabilized by the ligaments. The upper vertebra sits tightly on the lower vertebra and moves smoothly inside its socket. When the ligaments are extended, the upper vertebra in its resting position sits upright in the facet joint. As soon as the neck moves, however, the ligaments are no longer able to properly retain the vertebra in its socket. This causes the nerves to be pinched as they leave the spine, which may result in tension, persistent headache, and symptoms of paralysis. Injury may also occur to the vertebrae themselves. During the backward motion, the fronts of the vertebrae fan out, causing the vertebrae to strike each other at the back of the neck. This produces micro tears and bruising of the vertebrae and cartilage. During rebound from the subsequent forward motion, the fronts of the vertebrae are compressed. This causes micro tears to the bones and to the cartilage. These injuries may lead to permanent tension and chronic headaches. Since the intervertebral disc is compressed, it sustains pressure which may cause its external surface to break. The large weight of the head causes massive forward forces and produces micro tears in the muscles that lead to muscle and ligament tension and to a limited range of movement of the head. The spine has a concave curvature. Muscle tension will cause the spine to straighten. This anatomical change constricts the space of the artery, which is compressed, which reduces the flow of oxygen to the brain. The consequences of this are dizziness and headache. Some nerves are also pinched by the straightening of the spine. This causes persistent neck pain and headache. The straightening of the spine also lifts the first rib, which compromises the blood vessels and nerve fibers that lead to the arm. This causes pain, symptoms of paralysis, tingling and numbness in the arms. The sense of equilibrium results from the convergence of information from three sources: the sense of vision, the organs of balance in the inner ear, and receptors in the neck area. The shoulder blade and trapezius muscles are involved in the posture of the head. Sinews and muscles contain receptors which relay the positions of the muscles to the brain. Due to the whiplash, these muscles will often accommodate unnatural postures and are chronically tensed. This leads to an altered perception of equilibrium. As a result of the injuries to the facet joints, the joint capsules, which contain large numbers of receptors, are affected. These receptors continuously determine the angular positions of the vertebrae in relation to each other and relay this information to the central organ. If these messages are not properly relayed by all the receptors, dizziness ensues. The inner ear is the most important organ of balance. But whiplash may cause trauma to the labyrinth of the inner ear, which damages the cells that relay the information to the brain. This again results in dizziness, nausea, and balance disorders. During the two whiplash movements of the head, the brain not only strikes the walls of the skull, but as a result of the different densities of the grey and white matter, the axons are extended or interrupted. This causes nausea, emotional instability, epilepsy, neuropsychiatric symptoms, memory and speech disorders, as well as longer reaction times and slower processing of information. A person subjected to whiplash in a low-speed collision generally sustains a complex combination of injuries. The consequences of these injuries are neck pain and headache, dizziness, vomiting, balance disorders, symptoms of paralysis, loss of strength, tingling in the arms and impairment of the brain. We now know that these injuries may be the result of whiplash even though the accident occurred at a delta V of less than 10 kilometers per hour. These injuries are often difficult, if not impossible, to diagnose.